So talk to me about your company. Is it all about AI? Is that the difference between your company and some of these other stocks facing a lot of pressure? Or is there a different narrative at play?
Look, we've been around for 20 years. I'm one of the founders of the company, as is Evan Roberts. And our view has been, how do we make care easier for patients and caregivers every single day? And as we've grown, we've adapted and adopted new technology like AI, and we've been using it throughout our business. And it's been wildly valuable for us, our providers, and patients.
All right. Can you spell out what the value is? Kind of talk about in your business, your core business. How does it help you as your business, and how does it also help your customers?
Well, it's everything from figuring out what your copay is when you walk into the doctor's office. So instead of handing over your card when you walk in and having them figure out what your copay is, our large language models figure out what you owe for what type of visit and when, where you are in your deductible, and do that instead of using a human being. And it's been wildly effective. We saw over 170 million visits last year, more than 14% of all the visits in the country.
All right. According to analysts, your company is also a play on the fact that our population is simply getting older and birth rates are declining, and so many more people, they want to grow older inside their own homes as opposed to going to some type of care facility.
So a third of the people that use us today, every single day, are over the age of 65. We've also seen, as people have used our product, that we've been able to add different modules into it that allow things like caregivers or the patients themselves to identify if they're at risk of fall, if they need transportation, if they have food insecurity, allowing the provider organizations to get them those things at where they live as opposed to at home. The other thing that we view very strongly is healthcare is where travel was 20 years ago, and so we view ourselves as booking.com of travel. People want to be able to book their appointments online. They want to be able to figure out which doctor to go to, and we help facilitate all those things. They want to move their appointments sooner. They want to check themselves in. That's something we've been investing in for the last 20 years, and we think AI is just accelerating that.
Also, we had some big developments in D.C., the passing of the so-called One Big Beautiful Bill and some significant cuts to Medicare and Medicaid. How does that impact your business, specifically your older patients?
Look, we're a very nonpartisan organization. We work with both sides of the aisle, and one of the things we've seen is that continuously healthcare costs are just a bigger part of people's lives. And at the end of the day, every administration we've ever seen has just wanted to deliver great care to the American population, and we want to help facilitate that and help facilitate doctors being able to run their practices and health systems being able to treat the plethora of different patients that they see. And we think that it's ultimately going to be, beneficial to us. But we're really excited about what's been able to happen across the healthcare spectrum.